Can we talk for a few minutes about how often borderline personality disorder is misdiagnosed as other conditions? The most common misdiagnosis is bipolar disorder. Now, there's a reason for this. It's because BPD is so niche, so hard to understand, and so hard to identify that many mental health professionals are undereducated on the topic to begin with. So even these people who specialize in BPD, you show up and a lot of times they're like, well, I don't like to put labels on things. I don't like to diagnose things. Just talk about your feelings, whatever, right? Another problem is the actual patient who's going in to get a diagnosis is undereducated themselves. They're seeking out help because they don't know what's wrong. But if they're honest with themselves and they review the condition and they review the symptoms and they realize they check off more of these variables than they initially realized, or initially figured, it makes more sense for them to go after what they know they need to treat. But most people who go in for help or therapy or whatever, they're not going in there thinking, all right, I have BPD. They're going in there thinking, what's wrong with me? Why am I like this? And when they're asked, what do you like? They say some of the common symptoms. They don't get too specific. They don't talk about the substance abuse. They don't talk about the attachment issues, the abandonment issues, the fear of abandonment. They don't talk about any of these things. They downplay their rage. They downplay their mood swings. And instead, they end up talking about, well, I get depressed sometimes. I go from being, extremely happy to extremely angry, or extremely happy to being extremely, sad or depressed, right? And mood swings and such are very common with bipolar. So a lot of people end up with a bipolar disorder diagnosis. And then the mental health professional is treating bipolar disorder, which isn't entirely bad because some of the symptoms are shared and you will get some treatment. But wouldn't you like to get all treatment? You know what I mean? So I would encourage you to watch some of my other videos that will help educate you on the full spectrum of the disorder, the BPD condition, how it forms, the different symptoms, what conditions can, be comorbid or experienced at the same time. So you go in a little bit more educated and you get a bit better service than you normally would. And I would also encourage being honest with your therapist or a mental health professional and admitting that you think you have this disorder if you think you have it. I know I myself had to figure this out by myself. I saw at least a dozen therapists or mental health professionals, and none of them were able to accurately diagnose me until I figured out what was wrong myself. So I hope this video helps. Don't suffer, guys. There is an answer.